Right now, local paramedics are overwhelmed with calls over K2. The synthetic drug has prompted hundreds of people to call 911. They're having bad reactions, and some are experiencing hallucinations, while others are facing low heart rates and blood pressure. And now our local emergency services are hoping to get ahead of the problem. KXAN's Chris Sadeghi explains.
More than 450 calls and 500 patients. It's running Austin Travis EMS ragged, but there are no signs of why.
We wish we did know whether it's a manufacturer issue or a supply issue.
Where this latest K2 problem is coming from is a mystery, and although EMTs are the ones showing up to help, they don't know just how many others are suffering.
It's early on, it's quick, and it's incomplete. We're only getting part of the picture.
Remember all the Ebola news last year? Or how about when there is a flu outbreak? The health department keeps track of those because they're reportable events. Doing the same with K2 might make it easier to fight.
A more complete picture, identify who's using it, why they're using it, where they're using it, and we can target prevention efforts to those places.
Requiring hospitals to report cases is something typically reserved for infectious diseases.
For instance,
Captain Rick Rutledge said there's at least been discussions that making K2 cases reportable would help them finally get in front of a problem they spend too much time chasing.
We're going to get a better picture. We're going to have a better public education campaign.
There is no hard proposal right now, but Rutledge says they have spoken to agencies like Health and Human Services about keeping track on K2. From East Austin, Chris Sadeghi, KXAN News.
Austin Health and Human Services told KXAN there are some local efforts that could help with K2 reporting, but making it a reportable event by law would have to be the call of the state health department. The spike in K2 cases here in Austin mirrors what's happening across the country. This graph showing the number of times people called poison control centers after having a bad reaction to synthetic marijuana. The dash marks the bottom. At the bottom, though, show the number of calls each week in 2014. The solid line shows the cases in 2015 have been much higher. You can see the number of cases was less than 100 a week until early April, and since then, the number of calls have dropped quickly.